So the mouth-body connection is so proven now for 15, 20 plus years that the health of the mouth and the gums in particular are going to have a very significant impact on how healthy the rest of the body is or anywhere blood goes, essentially. So our approach is just a thorough one. I mean, that's part of our initial examination is the gum health and where that's at. And then I think we do an excellent job of explaining any concerns we see about gum health, because unfortunately gum disease is a silent killer. It doesn't usually hurt until it's way too late. Kind of like high blood pressure, kind of like heart disease, diabetes. Usually you get something bad happens and then you realize, oh, I have this. And so the goal is to not let that happen, like try to catch things earlier and then educate. And then those are checked on every single time they come back for maintenance visits. The gums health is checked again. Diabetes and diabetic patients in general just don't heal as well as others. And because diabetes is a blood-borne disease, it has a great effect in both ways, a great effect on gum disease prevalence or how severe gum disease can become, because again, they don't fight things off as well and they don't heal as well. So it's a two-way street with diabetes and heart disease and other health concerns, that if one is present, the other probably is present, or your risk factors are much higher if one or the other is present. Depending on the outcome of like an exam, I mean, gum disease patients that have diabetes or blood pressure or are on numerous medications for some of those things are typically seen more frequently for follow-up to try to give them the best chance to maintain the best health they can in their mouth. So again, medicines work better for them, for their diabetes or heart disease things. Gum treatments are beneficial in that they cleanse the blood from where the infection's coming from. So if the gums are healthy, then the bloodstream is not getting any bad bacteria from the gums or the mouth that it takes to everywhere else in the body, including your filter organs and heart and liver, lungs, all those. Depending on what types of medications, sometimes we have to consult with the medical doctor. Most times I have a super thorough understanding of like what those medicines are and what those diseases and how they impact the health of the mouth, particularly the gums. But with those medicines, dry mouth is a big side effect, which increases cavities, frequency, and things like that as well too. So same approach as if they're 6 or 86, really. I mean, we're going to start off thoroughly and then evaluate their individual risk factors, their individual medications, if it's the older population, and then adjust accordingly, like on how our plan's going to be and maybe how more frequent we might see them. I think when patients go through like a smile makeover or a cosmetic change to their mouth, or even just a health improvement to their mouth is all some need, I think they start to look at the rest of their body differently. So, you know, some patients maybe will lose some weight they needed to, or start being more active or more social, which all I think just have a positive impact on their overall well-being. The studies between mouth and body relationship are super strong now and have been for a couple of decades, that dental visits are a key part of the overall health mechanism there, because two things. One, everything we consume goes through the mouth, and the bloodstream of the gums that protect our teeth and such are connected to every other part of the body that gets blood. So knowing that, it to me is the gateway for overall health. If you have a healthy mouth, there's a good chance the rest of you is pretty good shape, and vice versa. If it's not, there's a good chance that other parts of your body are also suffering as well.